You know that feeling when your healthcare experience is, well, it's fine, you get treated, sure, but you kind of wonder what makes it really good.
Hmm.
Like, what are those things, maybe unspoken things, that really matter to patients beyond just, fixing the problem?
Yeah, that's a great point. And it turns out understanding patient satisfaction, it isn't just nice to have.
Right.
It's actually pretty critical for making healthcare better and, believe it or not, managing costs too.
Okay. Cost too. Interesting.
Definitely. And today we're diving into some really fascinating research that digs right into that. It uses this clever tool called the Kano model.
The Kano model.
Yeah, to figure out what really drives patient satisfaction in a healthcare setting. We're mainly looking at this paper, evaluating factors affecting patient satisfaction using the Kano model.
Gotcha. So for you listening, think of this as like a quick way to get smart on understanding what people actually value, not just in healthcare really, but anywhere. This study has some, well, surprising findings about what really delights people, patients in this case, versus what they just sort of expect.
It's a neat shortcut to understanding service improvement, but specifically looking through that healthcare lens.
Okay, so our mission today.
Our mission for this deep dive is really to unpack this Kano model, see how it works in practice.
Right.
And we're going to focus on this case study from the Student Health Services at Missouri University of Science and Technology, see how they used it to get a clearer picture of what students actually needed.
Okay, let's do it. So we keep saying patient satisfaction. Why is it suddenly such a big deal in healthcare? It's more than just like good bedside manner, right?
Oh, absolutely. The research really highlights that focusing on patient needs, truly understanding them, it's become vital for several big reasons.
Like,
Well, for one, it genuinely impacts healthcare costs. That's a huge one.
how so? You mean if patients feel like you listened, they might follow instructions better, maybe avoid repeat visits?
Precisely. That's a big part of it. It leads to better engagement, better compliance with treatment plans,
Okay.
and that, in turn, is fundamental to improving the actual quality of care. Satisfied patients are more involved, and yeah, there's evidence linking it to fewer hospital readmissions.
Which comes back to costs again.
Exactly. It's all connected.
Okay, so satisfaction matters.
Yeah.
A lot. Now, this Kano model, you said it's different from just asking, are you satisfied? How does it actually work?
Right. So the Kano model, it's a specific method, a quality methodology designed to help us understand the, let's say, different types of customer needs and how people perceive quality.
Different types.
Yeah, what's really interesting is it moves beyond that simple idea that, more features or better performance always equals more satisfaction.
So, like, just because a clinic adds Saturday hours, it doesn't automatically make everyone proportionally happier. It might depend.
Exactly. It's not always a straight line. The Kano model sees that relationship between, say, service performance on some feature and how satisfied the customer is as more complex. It actually has some interesting links to Hertzberg's two-factor theory, from workplace motivation.
Vaguely. Motivators and hygiene factors.
That's the one. Hertzberg talked about hygiene factors, things that cause dissatisfaction if they're missing, but don't really make you satisfied if they're there. Think like a decent salary.
Okay. You expect it.
Right. And then motivators, things that do lead to satisfaction when they're present, like recognition or challenging work.
Interesting. So how does Kano translate that to customers?
Well, Kano categorizes these quality attributes, these features or aspects of a service, into 5 groups based on how people react to them being there or not there.
Okay, 5 groups. What's the first one?
First up are must-be attributes. These are the absolute basics, the non-negotiables.
Like table stakes.
Exactly.
Yeah.
If they're missing, you will have unhappy customers. But, and this is key, even if they're perfectly executed, they don't really boost satisfaction much. They just meet the basic expectation.
So in a clinic, maybe it's clean. Like if it's dirty, I'm out. But if it's spotless, I just think, okay, good. Not wow.
Perfect example. Then second, you have attractive attributes.
Attractive.
Yeah, these are the unexpected delights, the wow factors. When they're present, satisfaction shoots up. But if they're not there, it doesn't usually cause dissatisfaction because, well, people weren't really expecting them in the first place.
Like a surprise bonus feature. Maybe the clinic has amazing free coffee or sends a really helpful follow-up email you weren't expecting.
Could be, yeah,
Ugh.
exactly. Pleasant surprises. Third category, one-dimensional attributes.
One-dimensional. Sounds straightforward.
It is. For these, it's a direct linear relationship. The better the performance, the higher the satisfaction. The worse the performance, the lower the satisfaction.
Ah, okay. So like waiting time. Shorter wait, happier patient. Longer wait, less happy patient. Simple.
Precisely. That's a classic example. Then there's a less common one. Reverse attributes.
Reverse, how does that work?
For these, having the attribute actually leads to dissatisfaction, and not having it leads to satisfaction.
Huh. Like maybe overly complicated paperwork. Or maybe a feature that just gets in the way.
Could be, yeah. Or maybe an interaction style that feels too intrusive. Its absence is preferred.
Okay, got it. And the last one.
The fifth is indifferent attributes. These are things that, whether they're there or not, just don't really move the needle on satisfaction. Customers are, well, indifferent.
So maybe the color of the walls. Or some minor administrative detail nobody notices.
Possibly, yeah. Depends on the context, of course.
Yeah.
But the power of the Kano model is it helps visualize this whole more complex picture of what drives satisfaction beyond just more is better.
Okay, that makes sense. So this study we're focusing on, Missouri S&T, how do they actually use this model with their students?
Right. So the researchers applied this Kano framework specifically at the Student Health Services, the SHS, on their campus.
And what does the SHS do? Typical university clinic.
Pretty much, yeah. They offer regular medical care for students, colds, flu, minor injuries. Also things like allergy shots, some basic orthopedic care, standard stuff for a university health center.
Okay. And the goal of using Kano there was?
The main objectives were, first, to really identify which specific aspects of their service had the biggest impact, positive or negative, on student satisfaction.
Find the levers, basically.
Exactly. And second, to feed that information back to the SHS management and staff, give them concrete data to help improve the quality of care they were providing.
Did they have any starting point, like known issues?
They did mention some baseline data. They knew they had a high volume of visits, especially for acute problems, orthopedics, and those allergy injections. And they'd already flagged wait times as an area needing improvement from previous feedback.
Okay. And the student population? Diverse, I guess.
Definitely. They pointed out it includes undergrads, grad students, students from the U.S., and also international students. So a real mix of backgrounds and potentially different expectations.
Right, that diversity could definitely play a role. So how do they actually survey the students using this Kano method? Did they just ask, do you like this feature?
No, it's a bit more structured. They developed a specific Kano survey.
Right.
And to build it, they were quite thorough. They looked at existing validated surveys like HCA-HPS. That's a big one for hospital patient perspectives.
Right, I've heard of that.
They also looked at other studies that had used Kano in healthcare before. And importantly, they used insights from their own previous satisfaction surveys at the SHS.
So they tailored it. What did the questions look like? You said it wasn't just, do you like it?
Correct. For each specific thing, they wanted to evaluate each quality attribute. They used a pair of questions.
A pair.
Yeah. One functional, one dysfunctional. The functional question asks how the student would feel if that attribute was present or performed well.
Okay.
The dysfunctional question asks how they'd feel if that same attribute was absent or performed poorly.
Ah, I see. Can you give an example?
Sure. Let's take an attribute like availability of appropriately qualified medical staff within 10 minutes of check-in.
Okay, speedy access.
Right. The functional question might be, if qualified staff are available within 10 minutes, how do you feel? The dysfunctional one would be, if qualified staff are not available within 10 minutes, how do you feel?
And the students choose from.
They had specific response options linked to the Kano model, like, I like it that way, it must be that way, I am neutral, I can live with it that way, and I dislike it that way.
Got it. So the combination of answers to the functional, dysfunctional pair tells you if it's must be, attractive, one-dimensional, etc.
Exactly. That's how they categorize each attribute.
Smart. What kinds of attributes did they ask about?
They covered a good range, things like staff friendliness, feeling included in decisions about their care, privacy in the facility, getting enough information about their illness and treatment.
Oh.
Quite a comprehensive list. It's detailed in their paper.
Yeah. And how many students responded?
They sent the survey out online. They got 138 responses back, and they ended up analyzing 70 complete ones.
70. Okay. So the big reveal. After analyzing those 70 responses, what did they find? Which attributes fell into which Kano categories?
Okay, so for the 21 attributes they looked at, the results were pretty interesting. The largest group by far was one-dimensional. 16 out of the 21 landed there.
Wow, okay. So for most things, better performance just meant higher satisfaction, as you'd expect.
Pretty much things like staff courtesy, clarity of explanations, those sorts of things. They also found 3 attributes that were indifferent. Students didn't seem to care much either way about those.
Right, but the really interesting ones are the attractive and must-be categories.
Exactly. And they found 2 attractive attributes. These were the things that could really delight the students.
Okay, what were they?
The 2 attractive attributes were, first, having appropriately qualified medical staff available within 10 minutes of check-in.
That speed factor again?
Yes. And second, the provision of after-hours care options.
After-hours care. That makes sense for students, doesn't it? Unexpected, but really valuable if you need it outside 9 to 5.
Absolutely. These weren't things students necessarily demanded as a baseline, but when the SHS could provide them, it significantly boosted satisfaction. Quick access and flexibility seem key here.
Very useful insight for the SHS. Now, what about the must-be factors, the absolute basics? Did anything fall into that category?
That was actually one of the other key findings. None of the 21 attributes were classified as must-be in this study.
None. Really?
Yeah.
That seems surprising. Like, isn't basic competence or cleanliness a must-be?
You'd think so, right? The researchers offered a couple of potential reasons. One, maybe the younger student population just has different, perhaps less defined baseline expectations compared to, say, older adults using primary care regularly.
Possible.
2, the SHS focuses mainly on acute care, sort of episodic visits, rather than long-term patient relationships. Maybe those fundamental expectations become more prominent in ongoing care.
So the lack of must-be's might actually suggest the SHS was already meeting those unstated fundamental needs.
That's a plausible interpretation, yeah. The basics were likely covered, so they didn't register strongly as must-haves that needed explicit confirmation.
Okay. So the model categorizes things. Did the study go any further, like ranking the importance within those categories?
Yes, they did. They calculated some additional metrics to get a more nuanced view. They looked at things like category strength, how strongly an attribute fit into its category,
Okay.
and crucially, they calculated better and worse values. These are sometimes called satisfaction and dissatisfaction coefficients.
Better and worse values. What do those tell you?
They basically quantify the potential impact of improving or neglecting an attribute. The better value shows how much satisfaction could increase if you improve that attribute.
So high better value means big potential for making students happier.
Exactly. It flags opportunities to delight. The worse value, conversely, shows how much dissatisfaction could increase or how much satisfaction could decrease if that attribute is poorly handled or absent.
So high worse value means don't mess this up. Potential for causing unhappiness.
Precisely. It flags potential pain points. So these coefficients help prioritize. Where should the SHS focus its limited resources for the biggest positive impact or to avoid the biggest negative impact?
Got it. So it adds another layer of practical guidance beyond just the category labels.
Exactly. It helps them understand the relative leverage of each attribute on overall student sentiment.
Now, you mentioned the student population was diverse. U.S. students, international students, different ages. Did the study look at whether these different groups felt differently about things?
They absolutely did. That was an important part of their analysis. They broke down the responses by demographics, age group, gender, residency status, U.S. versus international, and also self-reported health status.
And how do they compare the groups?
They use statistical methods. Fisher's exact test was one, which is good for comparing categories like this, especially with smaller group sizes.
Okay.
And they used that to see if there were statistically significant differences in how different demographic groups classified the attributes. Like, did men see an attribute as one-dimensional while women saw it as attractive?
And did they find differences?
They did find some statistically significant ones, yeah. They also calculated something called Kramer's V.
Kramer's V?
Yeah, it measures the strength of the association. So not just if there's a difference, but how strong the relationship is between the demographic factor and the perception of that attribute. Effect size, basically.
Right, the practical significance.
Yeah.
So what were some of the key differences they found between student groups?
Well, they found, for instance, a moderate association between gender and perceptions of the patient-friendly design of the facility.
Meaning men and women rated its importance differently.
Potentially categorized it differently, yeah. They also found links between age and views on the friendliness of SHS personnel.
Interesting. Younger versus older students, maybe?
Could be. And Health status seemed related to the importance of accommodating cultural restrictions. Also, residency status, U.S. versus international students, showed differences related to things like being kept informed about delays, the facility design again, and importantly, that after-hours care attribute.
Ah, so international students might value after-hours care differently, perhaps.
That's what the data suggested, yeah. These differences highlight that you can't always assume a one-size-fits-all approach, even within a seemingly similar group, like students.
And the effect size tells you how much attention you should pay to that difference.
Exactly. It helps separate the statistically significant findings that might be minor in practice from those that represent really meaningful differences in priorities between groups.
Okay, so let's pull this all together. What are the big implications here? What should the student health services, or maybe other clinics, take away from this study?
Well, for the Missouri S&T SHS specifically, the findings gave them clear directions. Focus on improving those 16 one-dimensional attributes because better performance there directly boosts satisfaction.
Right. Keep doing well on those.
And really lean into those two attractive attributes: quick access to staff and after-hours care. Those are their opportunities to really stand out and delight students.
Make themselves indispensable almost.
You could say that. And the fact that no strong must-be attributes popped up, that suggests they were likely doing okay on the absolute basics for this particular student group at that time.
But that could change, right?
Oh, definitely. Needs evolve, which is why the researchers also stressed the value of the method itself.
You mean using the Kano model isn't just a one-off thing?
Exactly. The study provides a really solid blueprint for how other healthcare units, especially maybe university clinics, could use this systematic approach. It shows how to develop the survey, validate it, analyze the results, and importantly, look at those demographic differences. They also recommended doing this kind of analysis periodically longitudinally to track changes over time.
Makes sense. Needs aren't static.
Right. And they also suggested future research, like comparing patient perceptions with provider perceptions. Do they see quality the same way?
Ooh, that could be revealing.
Definitely. And comparing results across different universities, too.
Okay, great stuff. Let's bring this home for everyone listening. What's the number one thing we should take away from this deep dive on the Kano model and patient satisfaction?
I think the core insight is that the Kano model gives us this really powerful lens to see the different flavors of satisfaction. It goes way beyond just a simple happy or unhappy score.
Right.
It helps pinpoint those specific features, those attributes that can either truly delight people, the attractive ones, or the basics you absolutely have to get right, the must-be's, or those where performance matters, directly the one-dimensionals.
And in this case study, the big delights were that quick access to qualified staff and the after-hours care.
Those were the standouts for the students at Missouri S&T, yeah. Key opportunities.
And this way of thinking must be one-dimensional, attractive. It applies way beyond just healthcare, doesn't it?
Oh, absolutely. Any service, any product, really. Think about your bank, your favorite coffee shop, the software you use.
Yeah.
You can probably identify things that fall into each category. What are the basics you just expect? What improvements directly make you happier? And what are those little unexpected things that make you think, wow, that's cool?
It's a useful framework for just being a customer, or even if you're providing a service yourself.
Totally. Thinking about what really drives value for your customers or users.
So if this sparked your interest, maybe check out the original paper, or
Right.
just, try applying this Kano thinking to services you use. Here's something to ponder. What are those attractive, delightful qualities in the services you really value? And do you think the companies providing them even realize how much those specific things mean to you?
That's a really good question. Are they aware of their own wow factors? It really underscores this ongoing need, doesn't it, to constantly try and understand what people value, how those values change.
Yeah.
If you want to keep improving and ultimately provide experiences that genuinely resonate, it's a continuous journey.